actions of the muscles even if you can't remember the name, right? Remember, muscles only pull. So let's say I put a mark in here and say name this or name its action. All you have to do is follow and see where it is going, right? And think about it. If I pull on this, what is it going to do? Right? It will dorsiflex. Now, also, when you're studying, the human muscle and the cat muscles are pretty much the same. The only difference is when we come, into the leg, right? With the cat, it's the same thing. We have the anterior tibialis anterior right next to the tibia. If we turn around, right, here's the gastrocnemius, right, and there it is the soleus. They come together to make the Achilles tendon, just like in the cat. If I pull on this, what is it going to do? It's going to plantar flex, right? Coming up here, again, learn it by lateral and medial. On the lateral aspect, we have the bicep femoris. On the medial aspect, we have the semitendinosus, just like in the cat. The lateral aspect is the bicep femoris, and the medial side is the semitendinosus, right? Again, look at this. The tendons are crossing the knee joint. If I pull on this, what is it going to do? It's going to flex the knee, right? When you look at, for example, the anterior, this here, with the human, here is the sartorius, there is the gracilis. With the cat, if you remember, the gracilis sits on the medial aspect of the thigh, and the sartorius sits on the lateral aspect. But when we open them up, just like the human, the big fat muscle in the middle is the rectus femoris. On its medial side, we have the vastus medialis. On its lateral side, we have the vastus lateralis. And up here, we have the tensor fasciolatum, right? Remember, the medial muscles, they adduct, right? The lateral muscles, they abduct. Just like the cat we had the pectineus, we had the adductor longus, and then we had the adductor magnus or the adductor brevis. The only difference is this is sartorius in the human, this is gracilis, which in the cat is right on top of this. But the rest of it is the same. The gastrocnemius, the tibialis anterior, all of that is pretty much the same. And we'll look at the cat again, right? Here's the gluteus maximus. In the human, that's the largest one. In the cat, it's the smaller. The gluteus maximus is small. Gluteus medius is large. In the human, it's not. So it really all are the same. Right here, for example, right, we have the pectoralis. In human, we talk about one pectoralis. In the cat, they are divided. Remember again that if muscle attaches to the thoracic or to the hip, right, their origin will be at the thoracic region or the chest cavity or the hip. Origin is on the immovable bone, right? Insertions on the movable bone. Again, here, not much is moving, right? So that would be the origin. It is on the anterior aspect. What's its function? Flexion of the shoulder, right? Right here, we have the huge latissimus dorsi. So at the posterior aspect, what can be its function is the extension, right? The traps. In the human, we talk about one traps. In the cat, they are separated. Yep. Remember, the lateral muscles are abductors, right? The medial muscles are adductors. Anterior muscle flexors, exception would be the knee. Posterior muscles are extensor, exception would be the knee, right? So again, right here, right, it is on the anterior aspect. So what's its function? If I pull this, what's it going to do? Flex the forearm, right? Here's at the posterior aspect. If I do this, what's going to do? It's going to extend the forearm. The lateral aspect, the deltoid, if I pull on it, what's it going to do? It's going to abduct the arm. So even if you don't remember the name of the muscle, the action really should not be difficult by just looking at them where they are located. Looking at their model, right? Right here we have the cell body of the neuron. These will be the dendrite. Those are the receiving part. They receive the action potential. Right here, the blue is the nucleus body. We have the nucleus and the nucleoli. Right here is the axon halox. This is the axon. Right? Here's the myelin sheath. This right here, the indentations, are the nodes of Ranvier. And right here, we have the endoneurium. Right? Here in the muscle, we have the endomyosum. In the neuron, we have the endoneurium. Looking at the spinal cord, again, the easiest way to remember, because you need to know which one is posterior, which one is anterior. The easiest way is locating the dorsal root ganglion, right? You locate the dorsal root ganglion, which makes this the dorsal root, which makes this the posterior gray horn, the anterior gray horn, the ventral root. Remember, here, the dorsal root ganglion, we have the cell bodies of unipolar sensory neuron, right? So the posterior is always sensory. The anterior or ventral is always motor. With the white column. So we have the posterior column, the lateral column, and then the anterior column, okay? The anterior is motor, the posterior is sensory. Looking at this model is pretty much the same thing. You find the dorsal root ganglion, you follow it, so this will be the posterior gray horn, the lateral gray horn, anterior gray horn. Right here we have the posterior column, the lateral column, the anterior column. Right here, right on top of the spinal cord, we have the pia mater, okay? This will be the dorsal root sensory. This will be the ventral root motor. Looking at the brain, if I hold it like this, right here is the olfactory bulb, olfactory tract, cranial nerve 1. But if it's just saying what is this structure, it's olfactory bulb, olfactory tract, cranial nerve 2, optic. Down here we have the cranial nerve 3, cranial nerve 4. If you look at these brains, it looks like it's coming from the back, and it does. And then cranial nerve 5. And that's all I really want you to know, because don't worry about these. Okay, right here, where the separation is, that's the optic chiasma. Not only you can see it from here, but you can see it this way. Right here is the optic chiasma. Looking at the half brain, we have the corpus callosum, right? Right here is the thalamus. This little dot is the intermediate mass. Toward the anterior is the hypothalamus, and this is the epithalamus. Right here is the corpora quadra gemini. Here's the cerebral aqueduct, and right there is the fourth ventricle in front of the cerebellum. The white in the cerebellum is the arbor vitae. The very first bump is the pons, And the second one is the medulla oblongata. What else?
The my arms. Do you need to know functions of medulla oblongata?
Looking at the eyes, I think by tonight you all have known it, right? These strap-likes are the rectuses. So the one on the top is the superior rectus. We have the lateral rectus, the inferior rectus, and then the medial rectus. Right up here is the trochlea. It's the superior oblique. This little pulley that goes through is called the trochlea, and that's how you remember. So superior oblique, right here is the inferior oblique. Again, remember, rectuses will do exactly what their name says. The oblique will do the opposite, right? Superior rectus, for example, will make the eye go upward. Superior oblique makes the eye go downward. Looking at the eyeball, right here is the sclera. Right here, the clear part is the cornea. This is the choroid. Right here is the iris. Again, in the middle we have the pupil. And the function of the iris is controlling the amount of light that goes into the eye. Right here we have the lens. We have the lens, and this is the vitreous humor. Inside of the eye, this is the retina. Right here where the optic nerve is exiting is the optic disc. Right next to it, that tiny little thing, is the fovea centralis. Okay? This mushroom looking back right here, that's the ciliary body. And obviously this is the optic nerve. Do we have it here? There should be here somewhere, right?